This test is called the Squish Test. It's used to determine whether or not your patient's pain is originating from the sacroiliac joint. There's two portions to this test. The first one is the posterior gapping portion. And so you're going to bring your hands on the lateral side of the ASIS and you're going to approximate those two ends, the two ASIS, to gap the posterior portion of the SI joint. And this stresses the posterior sacroiliac ligaments. And so if positive, the patient will complain of reproducing their pain. And so you're going to take up the slack first and then give slight overpressure. The second test is anterior gapping. This one can be a little bit more uncomfortable because you're actually going to push apart the ASIS bones. So you're going to come in through here and then you're going to apply lateral pressure this time. And you can imagine you're going to bring the posterior aspect of the SI joint together, so you're gapping at the anterior sacroiliac joint, applying stress there. If the patient is uncomfortable, you can ask them to bring their hands there, and then you can put your pressure through the patient's hand. And sometimes if you're uncomfortable working in this area, the patient feels a little bit more comfortable with their hands there for protection and to make it a little less ticklish. So again, the positive sign is if it reproduces the pain that they're complaining of.